足夠人數係，唔好意思啊，頭先，好，咁我哋開始啦，係。
Members, let's get started. Today, we are going to discuss, or we are going to sum up what we discussed in the past few meetings. This is the Joint Subcommittee on Long-Term Care Policy. We have looked at community care and residential care for the disabled and for the elderly. And we also discussed the community service coupon scheme and the support for carers. This is the last meeting. So it's the opportune time to sum up, especially in relation to the planning of residential care and inadequacies, for which we are still seeking answers to some of our questions. So let's be focused to see where we can seek progress. It's already been months. We would certainly like to get something for the elderly. And I would like to move on to other subjects come September. I'd like to welcome officials from the LWB and the SWD. There's no public hearing. It will be a session for an exchange with the administration. The issues are wide-ranging, so perhaps let's talk about elderly service, residential care, and home and community care services for the elderly, and then we move on to those for the disabled. And as for subjects that may straddle both sides, for example, support for family members and carers, then we can take it up as well. So 3 parts: elderly, disabled, carers. Any comments from members? Well, if you do not object, let's just do it. But before we go, we don't have any minutes to confirm. We would do that when the minutes are ready. So elderly, disabled, and a combined part in relation to our exchange with the administration. Mrs. Chen, would you like to give us an introduction? In the past few months, we attended a number of meetings. I would like to thank members and the deputations for offering your views. As I said previously, we understand that in some areas we have yet to do a better job. And we have heard those deputations. And we have already provided a lot of information in our papers. I don't see the need to repeat the information in its entirety now. Now and in the future, the administration will continue to invest in residential care and home care services. For elderly services, we have a budget of $5.58 billion. An increase of 12% over the previous year. In terms of places in residential care for the elderly in the past 5 years, or from 2007 to 2012, we have increased the provision by some 3,000 places. Even for day care, we have increased the quota by 600 in our centers. These are center-based services. And also for the home care services, the quota has go up by 2,000. And in the future, in our homes and community care, we would be providing more services. We'll be providing newer services. Members have offered comments. They are duly noted. As I've said, we may not be able to give you the answers that you would like to get right away, but we would go back and take a look and do some study at those issues. I think for the time being, that's all I want to say. Anything from Mr. Siu? Well, I will be providing my input when we proceed to the discussion on the disabled. Deputy Chairman, any time limit? Well, we have more time today. Maybe in the first instance, everyone will be given 5 minutes. First of all, a note of gratitude. Well, I have not participated in many subcommittees, but this one has had quite a few number of meetings. We have been looking at macro issues. It's hard work for members and also for officials. As the chairman has put it, we want to seek a way out. Perhaps we cannot expect all these needs arising from the waiting list can be resolved within the current term of government, but the important thing is to look at the planning, the way ahead. I think one of the most representative organizations that have spoken to us is the Hong Kong CSS. Actually, we have entered a period of population aging. The alarm bell is starting to ring, as the FS has observed. We have some 240,000 applications since the introduction of the comprehensive reviews, comprehensive assessment system. We started with 180,000 cases. These cases, these people require community care services or residential care services. Well, it's easy to project the aging population, unlike the disabled. Do you have any projection for the coming 10 years? In 10 years' time, with those with medium, moderate degree of impairment as assessed by the standard care needs assessment mechanism? How many places can be provided under the quota? How much manpower is required to fulfill the statutory requirements in the provision of such services? The sector and the service recipients are all concerned about this. The lack of resources is a separate issue. When we read the Hong Kong CSS submissions, we noted that in 1998, some academics from Harvard were engaged to look at health care. But for long-term care, we must look at the funding, the resource requirements. Would it be altogether shouldered by the government, by the public sector? Have you got any new thinking? In whatever forms, it's agreed that in an advanced economy, we have to do something about the elderly and the disadvantaged. So, can you give us more in relation to population projection? And secondly, what are your proposals or ideas in tackling the funding issues? Mrs. Chan, as we have stated in our supplementary papers to the subcommittee, when we look at the manpower situation or the provision of places, daycare services, and the additional places that we can provide, well, all these are in the papers, and I won't repeat all the information now. if we have an accurate projection of the need from our elderly, and then we can calculate the provision levels. That would be the ideal situation. But I remember at one of the meetings, well, that would be something scientific in terms of calculation. But because of the advance in healthcare, people are also attaching more importance to one's health. So there are some variables that we cannot really take into account adequately. And also there's something in between the home care and residential care. So that's why we cannot tell you that that the service needs would be like this and the provision would be like that. But we're talking about long-term care in assessing the future need and service provision. We will need to factor in all these variables. We have already provided information on manpower, and I don't think we should repeat all the information here. As for the long-term financing of the services, as the FS has stated in the budget, we need to look at the long term, not just services for the elderly and other service areas as well. We have to look at the long-term investment. We're doing something internally. If we have further information to furnish, we would let members know. Community organizations and members here are frustrated because for a long time you are unwilling to plan based on some projection model. There is a big disagreement between us and the administration. Let's use some presumptions. For example, age of admission 80, the average lifespan for women 86, the medium, and so on and so forth. We can do some projection based on these assumptions. Of course, no assumptions are perfect, but we need to do something and let people know what would happen.
Mrs. Chairman, yes, we have heard the views loud and clear, and we'll go back and consider how appropriate measures can be introduced in terms of assessing the future needs and how planning for a long-term care and future can be formulated. But the responsibility of planning lies with the government. Only the government can plan for such services. Now the question was on the long-term care needs in the coming 10 years for elderly, and what you said just now, it's really alarming. You seem to be saying that there is no way you can make any projections because of medical and technological advancements. It's impossible to project the needs, and it's also up to elderly to choose what types of homes or services they want. So you're saying that we have no idea what the future needs may be, and you can only tell us how much more can you provide in the future. But this is totally unscientific, and you are dodging the question. You're not facing up to the issue. We all understand that the population is aging, and as the population ages, we understand that in terms of healthcare and community care, the demand will go up. Of course, we can't tell exactly how much the increase in demand would be, but you do have a lot of experts within the government, and you understand how much resources the government has, and you have expert opinion, and if you say that it's impossible to make assessment, I think you're being irresponsible, because without your projection, we don't know how much, say, professionals like occupational therapists and physiotherapists would be needed. We're in the 21st century, and what you say does not tally with the situation now. We need to have this meeting because we need to have planning, and this is the core and the crux of the matter. But Mrs. Chan, your reply suggests that no planning could be done, and this is not what a responsible government should be doing. I think you should modify your comment. Yes, we accept members' criticisms, and in terms of the variables I mentioned just now, we will come up with a way which will form a more feasible basis for calculating future needs. Now, currently, as far as manpower, or as you said, the number of places in homes are concerned in the future, but you're only focusing on supply. You're ignoring demand. But for demand, as I said just now, there are variables. We understand, of course, against this backdrop that things should be done. And like I said, we will set assumptions. Say we will base our considerations on a number of factors and see how this can be achieved. Chairman. No, you cannot just see and consider. This is what you must do. Mr. Tan Ka-piu asked you a very reasonable question. And throughout the years, we have been asking the same questions. On population projections, you have all the projections ready. How about the need for long-term care services? And you haven't been able to come up with an answer, and this simply cannot do. The chairman asked a second question. That is, after you gauge the needs, after you make projections, you need to allocate resources to solve the problem. In many other countries, they have started financing schemes for long-term care, and contributions are required. Well, you can't wait for 2023 before you say that the amount is too large and taxes would have to be imposed. Well, this is why we hold this joint subcommittee on long-term care. We must start now, and I don't know when, but you must come back to us. I don't know whether it will take a month or two. We will be in recess in the coming months anyway. In terms of long-term care services in the coming 10 years, you must gauge the demand. You can't ignore the demand and simply tell us what you're going to provide. You can't dish out money in a piecemeal manner. Are you going to ask elderly people to take to the street on the 1st of July? Because this is a rational request. You saying that we have no planning at all. Chairman, perhaps I didn't make myself clear. I'm not saying that I won't do it. Really, I didn't say that. As for how this should be done, like I said, there are a number of considerations. There are new services. There are different sorts of services. And like I said, we need to set assumptions in projecting future demands. And these assumptions will form the basis for our calculations. And we need some time to make these assumptions and form the basis. So can you give me a timetable, Mrs. Chan? Well, we need to work with the Social Welfare Department, and we also need to review the comprehensively the services we're providing. I can't give you an exact timetable as to when our task will be completed. We hope that within this year we will be able to form our preliminary view and report back to members at this subcommittee. But does it mean that our plan will be agreeable by all? I don't think so, but we can discuss the plan. So the timetable is within this year. Yes, we hope preliminary ideas could be voted. Chairman. Mr. Chan Kwok-chi. Thank you, Chairman. Chairman, next Monday, the panel on welfare services will hold a meeting, and one of the agenda items will be on planning. So having heard what's said today, I think PAS should advise Secretary for Labour and Welfare on how he should answer our questions. We need to have new ideas, or we can save the discussion. Chairman, on planning, what my view is that the government does take it as planning, but the government only focuses on supply. It's just the government's own output instead of placing any weight on demand. That is, they look at their own resources. They can consider how much resources they have and how much or how many places for for example, how daycare services can be provided. But this is not in line with public expectation, and this is not in line with the approach for formal planning. You mean they're working behind closed doors? Well, we can't call that planning. Well, they just make calculations on the quantity of services based on what resources they have. They don't look at the problems in between, and they don't look at how the problems should be resolved. So, Chairman, you were right in saying that we are in fact receiving, teaching lessons. I think some government officials should be retrained. So my view is that I hope the government could collate the information and disclose the information to us so that the community can do the planning. Chairman, we really want to come up with a plan and then ask the government whether this can be done. Deputy Chairman asked about the 200,000 applicants under the standardized assessment mechanism. I have never seen the analysis based on this information. We have never been told the health situation or conditions of elderly people, because this could serve as a very objective indicator for us. Well, PS mentioned just now that many elderly people are enjoying good health because of healthcare development. And never mind about that, we can factor in a percentage, and then we can look at the number of frail cases, number of healthy elders, and then we look at the frail cases and see what healthcare needs the elderly require. Any social worker in the field of elderly care services would be able to tell you that, but they do not have any authority. The government, however, does have the authority, but the government hasn't done anything of this sort. If you have, please tell us the analysis you conducted on the information collected, and please disclose the information to our subcommittee for reference. So, yes or no question for the government. Have you done such an analysis? If you haven't, will you do it? If you have, we need to project the 1.03 million elderly people aged 65 or above. This is the current situation, and the number may reach 2 million in future. We need to, based on these figures, gauge the need for elderly care services, and then gauge the demand for home care services or home services for elderly. For example, some elderly people might pass away after being admitted into a home for 1 to 3 years, and then we can come up with a plan for rotation. We have several 10,000 in the waiting list, but you need at least 5 to 7 years for a site to be identified and for a home to be built there. And we're not talking about manpower problems. I think the government officials must have considered all these issues. But you would rather remain silent, because if you say more, you will receive more criticisms. Okay, we have ample time today. The first part will be on elderly services, and the second part on the disabled, and the third part will be on both issues. I'm sorry, Chairman, I just received a group of elderly people, and they have asked me to ask Ms. Cecilia Lee, Assistant Director of SWD. Last time we talked about a basket of services for home-based care services, and you said we'd go back and look at the issue. So please give us a reply, because we have a group of elderly people up there. Well, our speaking time limit will be relaxed today, as we have ample time. So 2 parts of the question. The first part on information. You have 200,000 elderly applicants under the standardized care needs assessment mechanism, and based on the data, you can look at the demand for long-term care services. You have already collected a vast pool of data. So can you say something to us about this, and also a more general question on improving or the enhanced home-based care services, whether there will be a bundled arrangement?
Ms. Lee, let's talk about the standard care needs assessment mechanism. We're talking about a cumulative figure of 200,000 starting from 2001, since we introduced this assessment mechanism. And this is used by the Department for service matching purposes. And we do not really try to study or look into the profile of the recipients. And the social workers are not required to note or track the change of the elderly's physical condition and inform us. Therefore, the information on the list may or may not be up to date. If we require this to be done, the social worker will have to show them more work. At present, what they have to note is the choice of the applicant. This is updated very quickly by the welfare workers. We're not saying that all the questions can be answered by the assessment mechanism list. Since 2001, what was the average age of the applicant in 2001? How many of them suffer from moderate impairment or more? And also, since 2001, has there been any change in the age, medium age, or physical conditions of the elderly? And forgive me for referring to this. There are international standards on when to make a referral. For example, self-care ability, all these are already listed there. And you can conduct some research on that. Don't tell me that you have done this for more than 10 years and yet it's not helpful at all for the projection of service requirements unless you are holding on to something valuable without knowing it. If you allow the academics to have access to a database, a lot of people can put it to good use. I'm not an expert in this, but I do think that you should not try to evade the issues. You have a database. The database is useful. Are you going to do the analysis as required? We're still assessing the long-term system for assessing the demand. We are considering having a consultancy study. I think such a study can inform the government and the public and enable a better understanding of the long-term need for care. But in the past, the assessment mechanism is just for matching service. So a particular applicant has a certain need, so he or she would be put on a waiting list for residential or community care. So it's basically for matching between the service recipient and the service. When we liaise with the service sector, it's very often that the applicant would require both community service and residential care service. So things are somewhat fuzzy in that those requiring long-term care must receive service at the community level in the residential care homes instead of in the community. We must ascertain the facts before we can get a clear picture on the service requirement. I think Mr. Peter Chiu-hung is saying that you should not just be considering doing something. You should do it. You should consult the sector, the recipients, the academics on how to use the information stored in your database to inform you or to help you to develop the projection model for future service assessment. Don't waste the data you gather over the past 10 odd years. Will the elderly people like to get residential care, community care, or both? Here I can offer you a piece of advice. I think it's in line with the majority view internationally. Living independently is the objective of long-term care. It's better than residential care or life in a home. Why is it that in Hong Kong, so many of them, so high a percentage of elderly people opt for residential care? It's because of the serious inadequacy in community care, and these people don't want to become a burden of their families, and that's why they agree to be admitted to a residential care home. You must understand this. Well, whatever the living conditions, it's always better to live in your home, because in an elderly home, you are under the charge of someone else. And in your own home, you are in charge of yourself. You are in charge of your own life. So the world trend is that you should maintain the elderly's home living environment as far as possible. And then community care and residential care would see adjustments. Residential care would drop if you can facilitate their staying home. So please look at other countries' ratios between daycare and residential care and community care. The data are there for you to refer to, and then we can, based on our own aging population profile, project the long-term demand for the care. I agree, Chairman. Aging in place is what the elderly would like to get. And that's why we are moving towards the same direction. Apart from providing more daycare quotas, we are also going to pilot a community care coupon scheme. Last time the question was raised as regards why the quota was so low. It's only 1,200. Well, since it's a pilot project, we would like to see more integration between day care and community care. If this is acceptable to the elderly, and if the elderly is assured that while they get community care, their applications for admission into elderly homes will be frozen, but the applications are not cancelled. It will be frozen, and when the need comes one day, they would be at the front of the queue. Community care must come first. And 3 years ago, the Elderly Commission, published a report expressing concern about residential care. We must have a better community service for the elderly before we can consider a voucher scheme for residential care. So we need to have a pilot scheme first. That's another technical issue, and that is the improvement to the home care services. Last time, an elderly woman complained about the lack of escort service to clinics, and the service provider was asking her to also apply for the meal services, but the old woman didn't want that because of the time, the delivery time is at 10 a.m. for lunch and 3 p.m. for dinner. There are so many titles, so many services under different schemes. I think some consolidation should be done. So it's a bundle service. If you apply for one, you have to apply for both, and as a result, that women didn't get any of the two. Can you clarify that this would be the case? In the service agreement, there's no bundling. If you know that any particular service provider asks for bundling of services, we would like to know. Then we'll try to understand why the organization, the service provider, would like to have this, would like to impose this on applicants. Well, this has to do with the scores of the points system. Dr. Helena Wong, I heard that there was a question about allowing access to the database under the assessment mechanism. You said that you would consider engaging some consultants to look at the data and to do some future planning. And the question of allowing community access or as access by scholars to the database was evaded by you? I don't think the two are mutually exclusive. Can you open up the database to both? I don't rule out the need for you to do some consultancy study, but can you still also make the database available to others? For example, the government has got some air quality data. The community and the academics in those fields have access to those data. You can get information by just giving the department a USB thumb drive. So perhaps the administration can tell us whether you are willing to open up the database so that there can be some community planning as well. Because to do a proper planning, we have to go to details pertaining to different districts, the waiting time, whether there's any shortage across districts, the conditions of the elderly applicants, how many are suffering from dementia and how many are not. Without such information, there's no planning that we can do. And if you don't want to use the information like this and you don't allow others to use it like this, there's no planning to speak of. And we've heard that carers will have certain aspirations. Of course, the Democratic Party supports the policy of aging in place. But for those who are waiting to be admitted to a home, they will have to rely on daycare centers, or they gain access to the pilot scheme with a quota of 1,200 places. So in the meantime, perhaps you should provide an allowance to the carer. It's not just about catering to the needs of the elderly. We are talking about the carer who may also be under some financial pressure because they cannot work. They have to remain at home to care for the elderly. In some other countries, there will be a financial assistance. If you spend up to, at least a certain amount of time in caring for the elderly, then you are going to get a monthly allowance as carer for an elderly family member. Would the administration look into this?
Well, I will say something about the carers allowance. On one meeting, we discussed the support for carers, and we talked about carers allowance. Now, on carers allowance, we already agreed that we will consider it at a policy level. And I understand that there was a working group under the CCF. They're looking into this, and they are already looking for some information. I don't have any new information to supplement after the last meeting. Any timetable? I don't have any at hand because the CCF's task force is taking the lead. But we all understand that the support for elderly carers is important. I understand that they will start work as soon as possible, and we will supply the information once we get them. On releasing the data, for the data collected over the past 10 years under the Standardized Care Needs Assessment Mechanism, I will go back and see what data can be extracted. Maybe analysis could be conducted on a yearly basis. For example, the age of the elderly applicant on the waiting list, or whether there are any indications on the level of impairment. And as I said, the whole system is about service allocation. We have not retrieved the data for this purpose. And I don't think this is a secret. Of course, the data should not contain any personal data, but this will be accurate information. Chairman, but if we are to do planning for on the scientific data, if this is aggregate data giving us only the sum, then from the statistics point of view, it's not very useful because you have factored in many elements and it's difficult to conduct an analysis. For example, gender mainstreaming, we need to get data, for example, gender, age, and the level of dependency, so on and so forth. Whether the subject is suffering from dementia, and whether he can take care of himself, and whether he is supported by any carer. Clarity of data is important. Just give us the raw data, don't give us the aggregate. Just delete the name and the ID card and give us all other information. Only by doing so we'll be able to come up with a meaningful planning. If you only give us very vague data like the number of applicants and the year of waiting on the waiting list, yeah, we already have this information, but this will not help in formulating long-term policies. So do you mean that data should be released for academics to conduct analysis in the long term? Ms. Lee. As I said just now, I don't know what can be extracted from the data under this standardized care needs assessment mechanism. So I don't know whether all your key needs can be catered for or just some of your needs. So I need to go back and see what data can be extracted from the system. So after the meeting, perhaps perhaps the Hong Kong CSS or the other users might contact you and see what information they can get. Mr. Leung Yiu-chung, Chairman, lack of home care places. Well, we have been talking about this problem many years, and many applicants died whilst they were waiting for a place. And we need to expedite the progress and resolve the problem. The government keeps telling us that it's difficult to find a site for a residential care home, and time is needed for RCHE to be constructed. And at the community level, well, there are other problems like remote location and difficulty for the elderly relatives to visit them. And now for PRH reduction, the target is set at 15,000 per year. Can we take a step further? Let's say for each housing estate, at least, let's say, a floor or two can be reserved for residential care homes. Let's say we have 40 units per floor. They can be converted into bed spaces, and the number of bed spaces would be quite large. And if we require each PRH estate to provide a certain number of bed spaces, this will save us a lot of time in identifying land and building homes, and the supporting facilities in the community would be quite good as well. This can also guarantee, because every year we have new PRH estates being completed. And Chairman, after completion of the construction, other supporting facilities like transportation, well, they will gradually be improved to catch up with the needs. So can the administration look at this proposal and see whether a floor or two can be reserved for each PRH estate for homes to be provided there? In fact, this will not cause a drop in the number of PRH units provided, because for elderly applicants, well, some of them live in one-person household a one-person unit. So if they move into these homes, the units can be vacated. Well, some of them may live in private housing, but I don't think the number is substantial. Let's say if 200 units could be preserved per estate, then this will give us very good prospects. Every year, 4 or 5 estates would be completed. Let's say we have 4 estates per year, and then we can guarantee 1,000 places per year. Well, in some years, the production might be even larger. This year, accordingly, it's set at 17,000. So it's a win-win situation. That's my proposal. And this also comes with good planning, because this will happen to each and every district. Because if you want to identify the particular district or site, it may be a very remote location. Over the past 5 years, according to my calculation, they have 600 additional bed spaces per year. That's places for elderly. So the figure you have quoted already exceeded the supply over the years. Yes, and it's not difficult. Let's say if they can provide 100 and 200 units per estates, or 100 or 200 places in the homes. Well, it's not difficult, and they don't need to reserve many floors, just 1 or 2. Mrs. Chen. Well, let me say a few words, and I'll let Ms. Lee to supplement my answer. Apart from identifying locations in PRH estates for URA projects, we also try to identify locations, even in private housing estates as well. I just flipped through the information. In the coming 3 years, 7 new homes will be completed, 2 of which are actually inside PRH estates or under URA projects. That is, we have earmarked location for these homes. And all along, apart from working with the housing department, we also work with the planning department. On land use, we have been in close liaison with the planning department. We have been telling them our wish to include certain welfare facilities, not only residential care homes, of course, although there is a greater need for care homes for the elderly, but we also have other social welfare facilities for, say, teenagers and the family, so on and so forth. And we would like to identify sites across the territory for such services. So our mechanism is that whenever new estate comes on stream, we will tell the relevant departments what facilities are to be placed there, and we will try our best to look at convenient locations. Definitely, it must be accessed by public transport. Otherwise, the relatives of elderly people cannot visit them. So we do look at suitable locations for suitable facilities. Ms. Lee, please. Now, on providing RCHEs within PRH estates, of course, PRH estates is our first choice. It's within our control, and there is planning. And as mentioned in the paper, there will be an estate in Sham Shui Po, and also another estate in Shui Shun O in Sha Tin and Tong Chong. And all these estates will have PRHE facilities, and also some other sites as well. Some may ask why not all estates are provided with RCHEs or places for the elderly. Like Ms. Chan said just now, there are other welfare needs, and perhaps say in the surrounding of that estate there is no rehabilitation service at all, and then we will provide rehabilitation services. So this is why an impression is formed as to whether not all newly built housing estate is equipped with RCHEs. But like I said, I've mentioned 4 to 5 new estates where RCHEs will be provided. Chairman, 15,000 or so PRH units per year. That's more than 4 to 5 estates. I understand that other welfare facilities might be provided at these new estates, but I don't think there is a conflict if we provide homes for the elderly as well. Usually these will be situated on the second or third floor, and they can just convert the existing units, convert the existing units into homes. I think home care places is necessary not just for the elderly but for other groups as well. This will help address the demand, and this can also apply to residential care places for other groups for rehabilitation. Say daycare center for the elderly, this can also do, and there is no conflict. And this is what the government should do. They should discuss with the housing department and require that one floor or two on 2 or 3 floors of the estates should be provided with LCGs. Well, Mr. Leung, but my understanding is that it all comes down to planning. For PRH estates managed by housing department, they earmarked a certain area of space for welfare facilities. But it's up to the SWD to do the coordination and gauge the needs of the community and see whether facilities should be provided for the elderly or for other for teenagers or other groups. Now the problem is not about coordination. The problem is because they have no planning at all. They don't know how many more places for the elderly should be provided. They look at existing facilities, that is the area allocated by the housing department, and then they divide up the area. Say a proportion will be used for RCGs, and say in a certain year, if there are more PRH completed, they allocate more space for RCG. If there are fewer number of estates completed within that year, then the less space for RCG. That's the tradition. However, their traditional or the traditional practice is different from the reality, and that is why we have 30,000 on the waiting list. As the queue gets longer, people do not have sufficient supply, and the number of elderly people passing away whilst on the waiting list increase as years go by, and they don't know how they should plan for the homes, and that is why we are requesting them to have proper planning. Chairman.
Chairman, with planning, you can plan on the numbers, but it's difficult to plan on the locations. If you make some plan for a district, say for some urban district, and there's no space, no land, how can you construct the buildings? So the easier way out is to go for the housing estates. You have new housing estates coming on stream every year. That's the most convenient solution in terms of search for land and construction time. And you don't have to worry about community services, community facilities. But the question is how they don't know how many to build. Well, as long as you can liaise properly with the housing department, of course you have a constraints concerning the ratio of social welfare facilities. With an elderly home, maybe there is a reduction in the number of one-person units for the housing department. I think going down this route would remove many obstacles for the Social Welfare Department. Chairman, perhaps we can ask the Housing Department to come to talk to us about this. I think this is the best long-term solution. Instead of telling us again and again that you don't have land and you cannot properly plan for the construction time. Mrs. Chan, we have already told members the current practice. We would follow up with the Housing Department. On what? Well, I've heard from members that we should make it something mandatory to have certain facilities incorporated in new housing estates. That I cannot promise. But when the Housing Department builds new housing estates, we'll certainly tell them we need elderly homes, we need space. And you know, the Commissioner for Rehab is just next to me, and he has a hard time. We'll ask the Housing Department to provide space, but whether it's going to be a residential care home for the elderly or for the disabled, for some other welfare services, I cannot really give you an answer now. Well, if for PRH there is a pledge that the waiting time will be 3 years, do you have any pledge for the elderly waiting for the places in the subvented homes? Don't mix up with other issues. Or for the disabled applicants, it's over 10 years. Can you give us a performance pledge? Say 6 months. Chairman, you are not realistic. Well, this is reasonable. I think Mr. Siu can only laugh at this idea. We're talking about the most disadvantaged groups. How can you ask them to wait indefinitely? I can foresee the answer. They cannot give you a pledge because they cannot project the demand, something like that. Chairman, let me give you a different answer. Try to give you a different answer. In answering previous questions raised by members, Ms. Cecilia Lee said that for the long-term care demand, there are some shortcomings in the current model. Hong Kong CSS mentioned some of those in their submissions. That is to say, the elderly applicant can go for either choice, community service or residential care. Of course, they would like to join the queue since the waiting time is long, and therefore we cannot really tell who has an urgent need. Some 20,000 are waiting for residential care. For some of these people, they can remain at home if we provide better community services. We know there are inadequacies. We would continue to do more in the provision of community service. As for the allocation policy for long-term care, as Hong Kong CSS has pointed out, what we'd like to see is that those elderly applicants who urgently require residential care will be put on the waiting list for residential care. As for those who are already on the waiting list, who can be adequately served with community services, well, should get community services. Then we can shorten the waiting time. I dare not say that it would be as short as 6 months. At present, the elderly can wait on both lists. So the long waiting time is something that we cannot avoid if we allow them to wait on both lists. But we cannot make the changes in a few months' time, because this has to do with the whole arrangement of allocating services for long-term care. It's going to be a big operation, and people have a lot of views to offer, and we have to listen to them before we can finally do something to change the waiting time. And let's hope that the waiting time will not be as long as it is now. Well, we are just talking about the quantities, not the quality. We have not yet to discuss whether the quality of service is something that serve the elderly best, and the quality of standard varies in private homes, notwithstanding the statutory control and the licensing system operated by the SWD. From time to time, we have cases of elderly abuse or negligence. After some discussion, the administration promised to step up inspection, and there have been some prosecution cases. Monitoring by your department can be done at different levels. When you find out that there are problems, you can give a verbal warning, or for more serious cases, a written warning, and then you will consider issuing summons. And if you are successful in pressing the charges, you should go for higher level transparency. You should upload the information on your website. At present, the information is hidden under the heading latest news, and I don't know whether after a few months the information will be deleted. So I hope I don't know whether members have anything to say about quality control. And do you think that there are other measures that have to be taken to further improve quality of private homes? Don't give people the impression that the main quality problems all lie with private homes. Well, our licensing office is responsible for carrying out the inspections. They are surprise and announced checks. We're not going to let the homes know when we would go, and when we inspect the homes, we'll look at the manpower arrangement, the dispensing of medicines, the overall cleanliness, and so on and so forth. And as the chairman puts it, the first thing we want to do is to ask them to improve service quality. But sometimes there's no need to do that. For example, in terms of manpower, and if falls short of the statutory requirements, then we will have to give a warning right away, because it fails to meet the statutory requirement. As for prosecution, well, we need to make sure that there is sufficient evidence. Well, we have had successful prosecution cases, but sometimes it's frustrating that the accused got away in the court, because the court requires a very stringent evidential requirement, and sometimes we fail to convict the offender. But it doesn't mean that we are not serious about quality service. And of late, we also note the need to upload our information on our website. If there's a prosecution against a home, elderly home, we would upload the information and keep it there for 2 years, not 6 months. It's not under what's new, but under the information on homes. Going to an elderly residential home is an important decision to make, and if you want to send a family member to a particular home, you should check the information on our website. In other countries, they have this approach because it's difficult to comprehensively monitor the homes. It's a resource intensive. It may be a waste if you devote a lot of resources on monitoring. The best would be for them to be self-disciplined. In other countries, they would subsidize some elderly people to go on visits to the homes, like volunteers. They are ambassadors. NGOs will be subsidized to recruit a group of smart and bright elderly people who are willing to serve as volunteers. Their job is to visit elderly homes, to show care, and to talk to the peers, the residents there, because it's easy to establish the report because they are peers. At the same time, they would monitor, they would pay attention to the quality of service. They are volunteers. They don't have any official capacity. They are just visitors. But since they get the training, they shoulder the responsibility of identifying problems with homes. And through the NGO or the charitable organization, the information will be channeled to the authority, and in our case, the licensing office of the SWD. Such information is not conclusive proof of wrongdoing of homes, and the volunteers have to be trained. They are not spies. The volunteers offer service.
I think you can consider this model. Have you considered that? And will you consider introducing it here? Thank you, Chairman. Maybe I'll let members know about this. We do have such groups that's called Committee for the Quality of RCHEs, and these committees at the district level. The committees comprise district councillors and other members from the local community, and this term has just been completed, and for the next term we will again attract or recruit talents at the district level to, say, visit subvented homes and contract homes, but most of the time they visit private homes. For private homes, they welcome the visits by local individuals. They also accept the recommendations of this Committee on the Quality of RCHEs and make improvements. We can do more in this regard. Maybe at the next meeting we can provide more information. For example, the number of districts where such working groups or committees have been set up. And just to supplement on the last point, for successful prosecutions, we will retain this information online for 2 years. So for the Committee for the Quality of Homes, I think this should be promoted. Well, not only by district councillors because they have limited time, they may not be able to pay frequent visits, but we can have volunteers among the elderly. They can do the visits, and these smart elderlies can make acquaintances, and then throughout time they can, through the visits, reflect the quality of homes. I think you should promote this model, and it's also a kind of service, not just for quality control. So on RCGs and community care services for the elderly, any other questions, Mr. Tam Yu-chung? We have discussed this issue many times. Our arguments are very familiar to everyone. I think the important question is on implementation. There should be proper planning, and more should be done on implementation. Public expectation is getting higher, and this is also a problem facing elderly services. In the upcoming policy address, I hope to see some improvements on carers' allowance. It seems that the administration is willing to consider it. We have been talking about it for a long time, and this is an issue with resources and nothing else, so this is easier in terms of implementation. That's all. So let me sum up this part. This subcommittee has been talking about planning on the long-term care policy for the elderly. If we do not have a demand projection, there is no way we can implement such policies. So since you have data collected over the 10 years under the standardized care needs assessment mechanism, you can conduct analysis on the needs and form objectives. Once you've done that, you can consider suggestions, for example, earmarking floors within PRH estates for RCGs, and then you can increase supply and be target-oriented. Financing is also necessary. You may find that with increase in demand, recurrent expenditure will increase, and the current revenue from taxes will not cover it. So what alternatives do you have? I believe this is what healthcare financing is heading as well. The administration is encouraging people to take out voluntary healthcare protection plan. And I think we should head in the same direction. Long-term care is a crucial element in the population, and I think you should not ignore this problem. And we have also talked about the release and opening up of the database. And I hope that it can be implemented as quickly as possible. You talked about schemes for the discharged patients and integrated and enhanced home care services, etc. At least 4 or 5 types of services are similar to each other. So can you combine some of them or rationalize some of them so that elderly people will find it easier to understand these schemes and to know which queue they should join, instead of going through the standardized care needs assessment mechanism every time. Well, of course, the assessment mechanism is necessary, but for example, for the integrated home care service, since it is considered a separate scheme, the subsidies under that scheme remained unchanged, and the queue gets longer. For example, the an elderly woman is not able to get a home place, and then she queued up for community care service, and then there was a problem with bundled services. So please do more to address these issues. So now we turn to the disabled. On home and community care services for the disabled, I will invite the Commissioner for Rehabilitation to give us an introduction, Mr. Chiu. Thank you, members and deputations, for giving us many valuable views at the previous meetings. We understand that in terms of home places, daycare, and community support, there is room for improvement. So we want to go full steam in promoting these services. On home RCHDs, we have a three-pronged approach. First of all, we regulate all RCHDs, that is home care services for the disabled. And we also want to help the private sector to develop quality RCHDs so that the disabled will have more choices. On the 10th of June, we passed the second part of the RCHD ordinance, so that for unlicensed homes, they will be subject to prosecution. So apart from the licensing system, we are actively reviewing the enhanced the pilot board play scheme. Members asked about the raising of the limit from 55 or 50 or 55%. We're considering whether this limit can be further increased, and we're also reviewing the whole scheme. For example, on the pricing of places under the scheme, we review the price level and see if it can reflect the market rates. What we want to do is to help the private homes in improving the quality and providing more choices for the disabled. Some deputations also expressed concerns over a scheme, and that subsidies will be given to private homes in order to meet the licensing requirements. Well, details are not very familiar among the public, and the SWD has explained in detail its work. And on other private homes that breach the law, we're working with the Hong Kong CSS and other organizations. We'd like to redevelop the homes on the land which is owned by them, and additions can also be made. Now, definitely after addition of structure or redevelopment, more places will be provided. And some talked about relaxing the criteria for tendering or giving more flexibility for tendering, and one-stop support should also be provided. Now, on subvented homes, this is also this will remain our axis and a core. And in 2013-14 to 2017-18, we have already received $27 million funding, but this is far from sufficient. This only covers 30% of those on the waiting list, and we are still making efforts, and this is a rolling figure. We would like to give continuous supply. On daycare support, some deputations talked about respite services, and I can say for sure that we will continue with the respite services. And last month, the SWD made it clear to the NGOs that this service will continue, and some recurrent subsidy will be provided for the service. As for home care services for the people with severe disabilities, in March we are going to regularize this pilot scheme to cover all 18 districts in Hong Kong, and more homes will also join in, and we have listened to views to a number of deputations and members. And on the operational details, well, they will be released, and we will be consulting stakeholders and NGOs in due course so that the services will address the demand. And the SWD is also actively working with the CCF. There are 2 programs on the CCF. One is for purchase of breathing machines and for care for people with severe disabilities. We have heard some comments recently, and we will consider these cases when we consider regularizing the schemes. So you can see that we are actively promoting work in this regard. We know that there's room for improvement, and we will continue to listen to members and other stakeholders, and we will ask for more resources to improve the quality of service and increase the number of places. Thank you, Mr. Siu. Anything to say from members? Deputy Chairman. Chairman, sorry, I think I have to go first because I have another meeting to go to in a moment. Now, on rehabilitation service or service for people with disabilities, I think it's even more difficult to address the issue. It's not simply about projections. The government should do more. Now, I would like to say something about the waiting list for care homes. Of course, for the applicants with moderate to severe impairment, of course, the queue is long. Now, for long-term care, according to your paper, as at December 2012, the list comprises 1,300, but in December 2009 it was just several hundred, so 30 or 40% less. So definitely this queue is much longer than the queues for other services. So can you give me an explanation? Point number 2. Now, community support services. Well, I think one of the deputations about pre-primary schools for the students with special educational needs. Well, the parent group say that after receiving education in special schools, some vocational education can be provided, or at least some work shelters can be provided, but at least they need to wait for 5 or even 6 or 7 years. And there was an idea from members. Well, the students might have acquired some skills from the special schools, but then they do not have the platform to really put this into practice. And for the sheltered workshops and also the other selective employment schemes, well, is there a clear waiting time? And in terms of resources, can more be provided to stop them to putting the skills acquired to waste? This is my opinion. Have you considered this issue? 3 points.
Home for long-term care, inadequacies in adult services, and degeneration of skills. The Deputy Chairman is correct that in projecting the numbers of the disabled, more factors have to be taken on board. We agree that we may go for some preliminary or crude projections. As the Deputy Chairman says, we need to look at the demographic changes. And in the homes for the disabled, aging is also an issue. Because of the change in physical conditions, they will have to be admitted to different homes. And the turnover rate has slowed down because of demographic changes. We also look at the service demands, and that would depend on community support services. We try to gather some information to do a projection. As for the long-term care, there are long queues for different homes. When we get some sites, we'll have pay attention to the waiting time. New places, more new places have been provided to those with severe mental disability. Relatively speaking, the waiting time for other homes has become longer. So we need to look at the long-term places. This is a problem of insufficient resources. But when we have more new resources, we look at the waiting time, how long the queue is, and district needs. As for shelter workshop and selective employment places, the average waiting time is 57.6 for shelter workshop. 2,515 people are on the waiting list. Average waiting time 16.2, and assisted employment 79 people are on the waiting list, and average waiting time is 0.5. So of course the key is to increase the number of places in the different workshops. And we also coordinated our work with the VTC. For those who get admitted to VTC, they have higher skills and they have a potential to go for open employment. We have actually introduced something new with NGOs and parents, and that is the courses offered by the VTC will be adjusted to facilitate the enrollment. For those with lower skills, they will have to go to shelter workshops or rehab centers. But we understand that there is an overall problem of insufficient places. In sheltered workshops and rehab service centers, they need to be accompanied by someone to just go to the workshop. The waiting time is 57.6 for selective placement, 57.6 months. Maybe it's a question of districts. Maybe it's because of the uneven distribution of district services. When it comes to daycare service, we hope that the service user will be living close by. We know in the North District, as some members have said, day training places are suffering from a shortage. And there was a meeting convened on this subject. One of the NGOs has secured additional space in Wan Tau Tong. And we are able to increase 30 days places, not for matching purposes. And there's a vehicle for the NGO to transport the trainees to and from the training center. We hope the 30 places can be put into service within the current year. At Tin Shing Estate, there's also an integrated services center and also a hostel for severely mentally handicapped persons, and there are 50 places to alleviate the shortage in Yuen Long and Tuen Mun. So from time to time, we would do something like this to address local needs, but sometimes there are difficulties. When we see a big need, but the question is we need to identify the premises for the provision of places. We've been working hard, but still in the North District there's a shortage. So what we would like to do is to tell you what we have done, and also what the number of additional places, 30 of them, which we can introduce within the current financial year. Well, we're glad that for the daycare centers and selective employment center, you can add more places. So it's for daycare only, because the service recipient don't have to get a hostel place at the same time. In the past 8 or 10 years, there were fewer so-called non-matched places, and as a result, the waiting time has become longer. Apart from day center, there's also a problem with shelter workshop. For example, Tuen Mun, North District, the waiting time for shelter workshop is very long, particularly long, for a waiting time of 5 or 6 years. Has there been any progress with regard to shelter workshop? Our workshop and the integrated rehab center, service center provides 9,300. But for those offering day services, the number of places is 7,300, or 80% of them. We do notice that there are discrepancies within the districts. When there's a problem in the North District, we will do our best to identify suitable premises to meet the needs of the disabled. So far, no progress in regard to the shelter workshops in the North District and Yuen Long. Yes, but we would monitor the situation closely. Last time, when we received the complaint, the parents cried and they suffer mentally, and some of them had to go to see a psychiatrist. We don't want to see any tragedy arising from that. The two districts concerned, North District and Yuen Long, have not seen any increase in the places of shelter workshops for years. So please step up our effort. Last time we didn't have time for debate, but members of this joint committee are very concerned about this, and later on we may wish to take it up and discuss the matter with the secretary. So I hope you can step up the efforts and do it quickly, even with proper planning. The lead time to have something happen is 2 to 3 years, but now there's no sign of anything happening soon. Well, let me supplement. In 2015 and 16 financial year, we have earmarked some space in Yuen Long to set up an integrated rehabilitation services center with 150 places. Some 80% of the places will be used as as a shelter workshop. So still we have to wait for 2 more years. All right. Persons with disabilities and also temporary care for PWDs, a concern for parents. You are not going to stop this service. Are the services, existing services, with the addition of some part-time places, will the number of places be reduced? And according to the parents, what the problem is related to parents or respite services, is that the parents may have to get medical treatment, so an application has to be submitted in advance, but there is the need to have X-ray and a medical check of the child. So these parents are themselves sick. They have to be prepared for hospitalization themselves, and at the same time they have to prepare the child to be admitted. And if they have to be admitted to hospital urgently, and they have no other family members to care for these children, they will not be able to have access to the respite services. Can you exercise some flexibility? Because it's supposed to be for emergency, and still you want the child to be blood tested and have an X-ray first. As for the respite services, whether at the welfare services panel and in this joint subcommittee, we've heard views about from parents saying that in the coming summer it's going to be suspended. Well, I met with the 9 NGOs offering the service, and we have a recurrent resources earmarked within the SWD to allow the service to be continued. The NGOs have responded very positively in rendering the service. For new hostel projects, we are going to earmark services for these respite services. As the chairman has said, sometimes the case is urgent and it's difficult to provide for the manpower. So we are earmarked some places for this purpose. But of course, the balance is needed in deciding the optimal number. As for whether we can improve the services, well, we are going to have regular meetings with NGOs to monitor the utilization, and also whether the procedure can be further streamlined in case of emergency, so that the service can be offered in good time.
Yes, please also consider it in your future planning. Say if there is sufficient capacity for existing facilities to provide service. Say there may be a concern with contagious diseases, and if you provide a area for separation or segregation area, then at least you can take care of emergency cases. In other countries, I don't see any such requirements at all. I don't know why. Even for residential respite service, X-ray examination is required before admission is allowed. Say if facilities allowed, you can allow for segregation to address the concerns of service operators. Mr. Cheung Pok-chi. I can adopt a simplistic approach and divide PWDs into two categories. One is those with mental problems, and the other is non-mental patients or not. And I think that it is a good idea to have an integrated approach for mental wellness. You can consolidate resources, and then in each district 2 or 3 officers will be stationed at these centers for providing assistance to those with mental health issues. For those who do not have mental health issues, however, it's more problematic. We have sheltered workshop, employment, selective employment schemes, and RCHDs, and nothing else. It seems that there is no way out if you can't get in one of those facilities. Even if you get in one of those facilities, there is no way out until the patient passes away. Is there an exit for them? For the disabled, they can be employed. However, we have not done anything to help them find employment. And nowadays, we cannot increase to the quota to more than 2%. So it seems that they are like the elderly people. They get in, and the only way out is for them to eventually pass away. And it's time for an integration of services. A review should be conducted. First of all, nowadays, persons with disabilities are far more capable than their predecessors because of development in the society, and also social inclusion or tolerance has improved. And thirdly, we see more categories of disabilities now. In the past, we did not include autistic persons, or now we do. And we previously ignored some conditions, but now we have studies and research in identifying these patients. For example, people with disabilities might experience more complex conditions if they're autistic at the same time. So can you rationalize and make the services clear? I really hate the DCSC, the District Support Center services. It seems that they have included all persons with disabilities, but in fact the staff is having a very hard time because they need to serve people with various disabilities. However, this might be done in a fragmented approach. The expertise of a particular staff member might not help people with various categories of disabilities. So I think that this DSC is actually not efficient. You should not stop at putting a center at every district. More should be done. It's time for an integrated review. We should look at the existing facilities in the districts and see if they can address the demand. For example, as pointed out by Chairman just now, many parents of PWDs are concerned that their children might not receive the care they need once they pass away. Well, some of them may want to be admitted into homes, but they need to wait for a long time on the queue. So when we talk about planning today, we should think about these points. Thank you, Chairman. Mr. Siu. Thank you, Chairman. And thank you, Mr. Zhang, for your comments. Now we have heard views on enhancing the service for the DSC, and we keep an open mind. We'll consider making improvements. As for sheltered workshops, how our effort can be enhanced to secure employment for them. Well, as mentioned on other occasions, we will be rolling out a number of programs in due course. For example, increasing the incentive for employers from $3,000 to $4,000, or to extend the employment period by 2 months so that 1,500 will be provided, and a longer period for adjustment can be provided. At the same time, $20,000 will be given to employers of PWDs as subsidy in terms of modifying the workplace or giving out salaries. Well, Mr. Chiu-hung would know that for the special needs working group, we will also roll out some schemes to promote employment among government departments and as well as NGOs and private sectors. And for those with employment capability but have yet to reach the requirements, we will help them in meeting the requirements at workplace in order to enhance the employability of PWDs. Now we talk about service mode. For those with mental problems, well, these PWDs might join a workshop, and they might stay there until their old age. Some may enter when they reach 17 or 18, and in fact, does this mode really suit the different levels of mental impairment? With aging population, the situation will apply to these people as well. So shouldn't there be a reform on the service model? They come with different ages, and it's difficult to address the needs of or the employment needs of all of them. Chairman, maybe I can supplement here. I think the sector is being innovative, but the government only provides subsidy on the existing model. Well, if the government is minded to conduct an integrated review, I think that the sector can come up with a lot of new ideas. For example, as mentioned just now, for the employment centers and sheltered workshops, or the workplace in the open market, well, is there somewhere in between where we can introduce something? We have a group of capable people, and we need the social enterprises to take an integrated approach. If you let them develop on their own, what's the point? For PWDs running social enterprises, the government should offer some advantages for them in order to work. And I think that there should be an integrated approach, and there should be discussion with the sector. The problem is whether you're minded to introduce this approach. Otherwise, these people will stay in the sheltered workshops until they've reached the advanced age. Thank you for your suggestion. It's a valuable opinion, and we've also heard the valuable comments from deputations as well. There are young people working in those workshops who can eventually work in the open market, and that is why for the vocational training, we are trying to come up with adjustment courses. They may not be able to work in the open market at first, but training could be provided so that eventually they can work in the open market. Secondly, like we said just now, we will inject the $100 million in the scheme mentioned because we want to provide more training opportunities for them to join the workforce. So under the new scheme, we focusing on people who require adjustment training before they join the open market, and this is what we can do. For other general matters, we keep an open mind. In particular, with the aging of PWDs and people with mental impairment, well, we keep an open mind and we want to adopt a new way of thinking. We will follow up on them. Mr. Leung Kwok-hung, Chairman, the problem lies with the fact that the government doesn't have a long-term policy. You have a district support center. Well, it's the same as calling the government hotlines. You may press buttons, and after a number of referrals, you will eventually be referred to a particular department. And that's the same case. They will need to look for business, and business is getting worse because our neighboring places can offer cheaper, can offer similar services at cheaper costs. So, from a new perspective, there should be somewhere where these people can excel themselves, and there may be undeveloped areas like the green industry or recycling industry, so on and so forth. Say, turning food waste into soap. Yes, this can be done, but in fact, at present, there is nobody in the private market doing it. That's because it's not commercially viable. The business will definitely lose out, and the victims will definitely be employees instead of employers. The other point about employment service is that they cannot really put their skills into practice in order to earn a living. So if you go down the route of social enterprises, I don't think this can solve the problem. You must develop an industry to accommodate them. Say, social enterprises. You can operate an enterprise as a form of social service or community service. Then the buyers would most likely be the government or some organizations under the government. So that's a problem of input and output. If you have a target, if you want to address the problems, then you will operate such a business despite the fact that it will definitely be loss. And then the commissioner or the audit commissioner will definitely criticize your business, of course, because they don't have any emotions. They disregard the goal behind it. They only do money for value, value for money audits.
Value for money is not just about money or value or outcome. If you don't do a comprehensive consultation, you are not going to get out of this vicious cycle. In the past, bright people were engaged to produce chalks. There was a strike. The NGO did not treat them nicely. We still have a factory for the bride. Yes, and Mr. Andrew Jiang helped them in the strike. If you don't adopt this position, it's difficult. I'm not telling you this. I'm telling you this so that you can tell Mr. C.Y. Leung. It's a policy issue. I don't need you to answer it. Time is running out. Let me sum up. I think the most important thing is planning. Whether we're talking about the disabled or the elderly, whether we're talking about the homes, community support, residential home, there's a serious shortage of supply vis-a-vis demand, and the aging population is going to get worse, not better. As you have said, healthcare has improved. We are able to diagnose or assess people better, and therefore demand is going to go up. If you don't do planning, if you ignore the demand, if you don't put in place the provision of services required in terms of resources and manpower, people's grievance is going to get worse. But we are realistic. We are not saying that the government is omnipotent, but you have the responsibility to do the proper planning. I think the subcommittee has to make it very clear. I've heard from Mrs. Chan that before the end of this year or within this year, it's hoped that some preliminary documents, papers on some thinking and on some data can be made available. I hope you can do this for rehabilitation, because they are connected subjects. And we also talk about this database, the assessment mechanism, the same for the disabled. There is also an assessment mechanism. Can you make the information available for the projection of demand, or you can allow academics access to the database? I hope this can be done. And we also mention an allowance for carers of the elderly. You said you are going to consider this, and we also say that this should be done for carers of the disabled. And also please reflect our views to the CCF or the Elderly Commission. So at least we have covered all these. And Mr. Peter Chung has also made a very good point, and that is the mode of service delivery. Is it that once admitted, they will never get out until they pass away? The situation is not as bad for the elderly. For rehab services, the person admitted can be as young as 16 years old. So you need to carry out a review. With an aging population, we are going to see more problems. Recently, there was a mentally handicapped woman who was in her 50s. Her mother passed away, and the daughter didn't know and couldn't care for herself. When she was found to be in such a situation, she was already in a very poor state. And 2 years ago, there was a fire, and the mentally handicapped daughter was killed by the fire. The mother was in her 70s or 80s and couldn't care for her. So it's a tragedy. This subcommittee, I can't remember named, looking at aging mentally handicapped persons should look into this. And I hope we can explore these subjects in October. By then, I hope you can offer us something. We're also going to have an open hearing for deputations with regard to the aging of the mentally handicapped persons. If there's nothing under AOB,